Your sticky nose.
I know. Totally missed it.
Okay, great. Welcome everyone. My name is Sue Campbell. So I work with Natalia as the program lead for the MSc in Health Services Management. I'm a nurse by profession, and most of my health service management experience is in the third sector, working for international charities. So I worked in Africa for 20 years, managing health programs for governments and for charities. So absolutely you're welcome, and if you've got any questions about health service management, then I'd be delighted to try and answer them. I'll hand over to Kirsty.
Thank you, Sue. Hi, my name is Kirsty McCall and I'm the administrator for the Advanced Nursing Science and the Advanced Practice in Healthcare. I can help you with any of your registration queries, any of the programme queries, enrolment, and I'll be there to see you right through to the end.
Okay, who are you passing on to?
I'm going to give it to Emma.
Hello everybody, good morning. It may not be morning where you are, who knows, but it's sunny here in Glasgow. I'm Dr. Emma Brown. I work in critical care at the minute as a doctor, but I also work on the MSc critical care programmes. We run both online and on campus. Can't say enough about how wonderful they are. It's wonderful to see you all today. I can answer any questions about any of the programmes at all, or what it's like to study here in Glasgow, or in fact at the university, because I am actually a student of the University of Glasgow, also studying a Masters. I have an interest in medical education strongly, and I love digital education, wellbeing, student support, all of the above. Delighted to see you.
Okay, and we'll move on to Julie now.
Hi, so I'm Julie. I'm also one of the critical care teaching fellows. I studied medicine at Glasgow, done FY1 and FY2 at the Queen Elizabeth, and now I work in critical care as well as being a teaching fellow for the on-campus and online MSc students. So hopefully I'll see some of you this November.
Brilliant. Okay, well, let's just jump in and get started with some of the questions that have come in via our emails then. So I think this might be actually for critical care, Emma and Julie, if one of you want to answer. Is the studying going to be online or in campus or in hospital? And if it's the hospital, how can we go there with the high cases of corona victims that we have now?
So currently our plan is to have you guys on campus, but by on campus we actually mean at the Queen Elizabeth University Hospital in Glasgow. We have a seminar room in the ICU department, which we can use for teaching, and obviously there's no patients in the seminar room, which reduces the risk there. However, we kind of are in a second wave right now. Our plan at the moment is to have you guys come into the hospital for teaching, but if some days that wasn't possible, there could be the option to have Zoom lectures, but that would be a backup.
Mm-hmm. Okay.
I think you'd agree with that, Emma?
Yeah, absolutely. And the seminar room is quite big, so we can distance in there. But it's just nice. Students have found it very helpful to actually physically be in the hospital for learning.
When would be the date then for students to actually start or be physically in Glasgow for you?
So it should be the 9th of November, and we run our teaching, face-to-face teaching, on Tuesdays and Thursdays every week.
Okay, that's fine. Okay, I see some questions that are coming in the chat just now, the Q&A just now. If you hold off putting any questions in there, I've got a bunch here that came in via registration that I'd like to answer first, and then we'll get round to it. I see Nazilla and Natick have put in. If you just give me a little second, and we'll get around to those once we've got these ones done first. So could we get the opportunity to work as an intern at the hospital during studying? Again, I think that might be for critical care again.
Our students haven't previously. Do you mean as practicing as, what profession are you in?
Yeah, I think we'd have to sort of just maybe pop a little.
Yeah, do you mean like as a sort of a nurse, a doctor? We have lots of different people on our course. We have pharmacists, physiotherapists, doctors, nurses. I guess it would depend on your license. If you work within Europe and you're GMC approved, then I don't know that we would have an objection to that, but I would check with our program directors. I'll just put his email here just now, and we can look into that for you and get back to you.
Brilliant, thanks, Emma. So the next question we've got is, I suppose this could be for all of you. So we'll start with Sue, and then Emma, and then Kirsty, because I know Kirsty, you're standing in for Eileen. What subject will be written in the certificate? I take it that's the degree certificate. Is it the dissertation title or is it the actual programme title?
For health service management, it would be the health service management rather than the specifics of a dissertation, because it's the overall programme rather than just that one part of it.
Okay, Julie, Emma, would that be the same for yourselves?
So it would be written MSc in critical care, and it does not specify online or on campus on your actual degree certificate.
Thanks. Kirsty?
Just the same, but for the MSc in Advanced Nursing Science, you can also have a specialism in acute and critical care. So that could also be added onto the degree qualification.
That's interesting, good to know. Is there anything, Natalia, that you know anything about that, or are there any programs?
It's like what my colleagues said. Yes, that's correct.
Okay. So during this pandemic, what is your plan to make educational process safe for students? I think that comes down to just social distancing, etc. What have you all got planned for that for your programs? Who wants to go first? Sue?
Yeah, I can start. So in our health service management, we will aim to have some sessions on campus, but it very much depends on what the regulations from the government are at the time. We will hold weekly social sort of half-hour drop-in sessions, casual sessions as well, just so that you meet the other students on the module, albeit online, but build relationships. And we did this at the end of last year as well, and they were very popular with our students. And they were really just, you know, have a coffee and have a chat. And if any questions come up, then both myself and Natalia were there to address them. So the plan is that a lot of the formal teaching will be online in the beginning, but we should be able to have, at the moment, some face-to-face kind of informal sessions, and we will support you with a weekly online catch-up as well. So I think we'll keep you quite busy actually, and have quite a lot of contact with each other and with Natalia and myself. That helps.
Okay. And Kirsty?
All our teaching will be online. We'll have all the information on Moodle, and we'll also have live tutorials during the week as well. And we're also hoping to have face-to-face small sessions on a Friday morning. It will be just drop in if anybody's got any questions, want to speak to the lecturer, if they've got any difficulties. We're hoping to offer that as well.
Okay, and Emma and Julie, you mentioned earlier on that your teaching seminar room is fairly substantial to accommodate.
Yes, it is. So you come into the hospital currently, you're asked to wear a mask and to gel your hands. Come up to the seminar room. We're also a hugely supportive and social team of students and faculty. We have weekly wellbeing sessions where we all get to know one another. We strongly believe in community building and the positive effect that this has on your studies. Our students last year were very close and held their own study sessions. As you'll see on our Twitter page and our YouTube page, they were all very close by the end of it and still keep in touch despite being now spread all over the world. Our online sort of resources are huge as well. We work very closely with our digital team to provide Zoom sessions and our lecturers are experienced in doing so also. Our Moodle pages are very well built with quizzes and the likes to accommodate those sort of online sections of the learning as well. Julie, did you have anything else to add?
No, just that when you come into the hospital, it's face mask, hand gels, and there will be socially distanced in the seminar room, and you will be asked to wear a mask unless you're presenting something.
Okay, great. So how do you choose which modules to study in semester one? It might be obviously different per programme. So Natalia, do you want to answer this one for as an administrator?
Well, for each program, there are core courses, and some programs also have optional courses. The core courses, you would enroll on them automatically. That is, you do not have the option to not take them if you have any issues enrolling. And sometimes it happens, especially this year, because the system is set up a bit differently to accommodate the social distancing restrictions. You may discover that there are time clashes between different courses. So in this case, you just email the program administrator and we will help you enroll on the courses. When it comes to choosing an optional course and you cannot decide which one you would like to take or which ones, you can just email us and we will help you choose the courses that best suit your needs.
Okay, Kirsty, how does it work with yourself? Is that similar?
For Advanced Nursing Science, they're all core courses apart from one, so you only have one choice from either acute and critical care or global health challenges. For Advanced Practice in Healthcare, we've only got 3 core courses and the rest are optional. 1 in semester 1 and 3 in semester 2.
Brilliant, thanks. Natalia and Kirsty, would you be able to put up your administrator email addresses for your programs in the chat box there, just so that the students will have access to that as well?
Yes, of course.
Right, so what are the job prospects, opportunities and availabilities in health services management in the UK during and after the course?
I mean, there's issues around jobs, but then there's also issues about right to work as well. So if you're from another country, you might find there's challenges in being recruited for working for a UK organisation. There are many management roles in health services, whether it's still in the clinical environment or whether at a higher sort of towards board level. So there are a whole range of jobs, and there are particular websites that advertise them on behalf of the NHS. So there are plenty jobs. It depends on, perhaps what your other experience is as well. And it also depends on your right to work in the UK, I would say. Thank you.
Okay. Again, this is quite a general one that's sort of cross-programme. Will my course be ran completely online, and am I not allowed to come to the university campus? So who would like to jump in with that one? Anyone have an answer for that? Natalia, we'll ask you.
It depends on the program that you're registering for. So for example, for critical care, we have 2 programs that are run completely online in any case, independent of the pandemic. And then, as Julie and Emma have already said, Masters in Critical Care and Masters in Critical Care Leadership and Management. We are hoping that we will be able to teach the sessions in the seminar room at the hospital. For Health Services Management, it is an on-campus program. We are planning to teach the first weeks online. However, as Sue already said, we are organizing some informal sessions also on campus. If you cannot attend or would rather not attend, you do not have to. You will not be disadvantaged in any way by not attending. Is that correct? So yes, the material, whatever we will be presenting at these sessions, will also be available digitally.
Yes, we
For you
record
to
all of our
watch.
sessions.
Yes, but that was what I was saying, was about the health services management. Yes, that's those sessions, and so it will be very much a blended program in the beginning, during the first months, and as we progress through the pandemic and hopefully as things become better, then of course there will be more face-to-face teaching. Some of the optional courses on the program are completely online and some are on campus, so you will be regularly updated on what is happening.
Okay. Could you provide us with the academic calendar? I don't think that's maybe per program. I think that might be to do with the academic year. So I will get the dates for that for you, and it's actually on the Senate website webpage, session dates. So here's the link for the session dates for the coming academic year for everyone, and that's the link in the chat box for you. Okay, so what we'll do now is we'll just move over to the Q&A questions then, and I'll just read them out loud. Please make them as specific to the programme as possible so that I can ask your academics and administrators here. When will the MSc Advanced Nursing Sciences be taught face-to-face?
Moment, semester 1, the lectures and tutorials will all be online, but we're hoping to have face-to-face sessions on a Friday morning. Semester 2, we don't know yet what's going to happen with that, because it all depends on the government guidelines and what happens.
Okay, will you offer an opportunity for international students who will study the MSc Advanced Nursing Science to have placements for observations only? So,
We don't have any plans at the moment. There have been queries regarding that before, so I know that Eileen Cowie, the course lead, is looking into that, but at the moment there isn't anything.
What textbooks are we supposed to buy? MSc Health Service Management.
Hi, so when you register on the programme, when you're registered, you will have access to the reading lists for each of the modules that you take, and those reading lists are held by the library. So you're not really expected to buy any health service management textbook, but what we do have is a number of books that are available as ebooks that you can download for the library. It might be that you just want to download a chapter of a book. It might be that you want to download a whole book. So there is enough there online through the library that means that you shouldn't really have to buy a textbook unless you particularly want to. I mean, another thing we do is give you up-to-date resources, sort of publications and things like that. So journal articles for you to critique, and you know, because they are published quicker, then they're often more up-to-date as well. So I wouldn't worry too much about buying a textbook, and we certainly don't expect it.
If completing the health management course part-time, is it a recommended structure to follow to allow for completion in 2 years?
Yeah, I mean, the certain modules are only offered in certain semesters, and certainly myself or Natalia, if you get in touch, we can advise you. So clearly you would look at doing your project last, but there are some modules which, you know, are done only in semester 1, which are core modules, and so probably you would do half of them in year 1 and half of the core modules in semester 1 of year 2. But we're very happy to discuss that with you. Of the core modules, I wouldn't say there was any one that would be better doing, apart from maybe the introductory course, any one that's better to do in the first year as opposed to the second year.
Okay, again, health services management, this one again.
So could I just add some, just very, very quickly? Yeah, that we will have, Sue and I, we will have an introductory Zoom meeting on the 5th of November where we will introduce the new students to the program, its structure, and we will talk about individual optional courses on the program, and there will also be a representative of the School of Management where some of our courses are taught, so you will have plenty of opportunities to actually think about the optional courses that you may or may not want to take. Yeah, is that correct, Sue? Yeah.
Okay, so the next one again, health services management. Can we get guidance on full-time job opportunities after our course gets over?
Yeah, so what we would be able to do is give you links to where jobs are advertised. And what you find with a lot of jobs that are advertised now is there's very detailed information. So the job description, the person specification, all that information tends to be available from the organisations that are recruiting people. So there's a huge amount of information which gives you an idea about what sort of skills that might be transferable, what sort of areas you might like to work in. So certainly we can share information about where you would get that information as well. There's private hospitals, there's the NHS, there's private companies like pharmaceutical companies, there's a whole range of employers, if you like, or potential employers.
Okay, what about yourselves in critical care, Emma and Julie? Is there any help for people with regards to when they finish their MSc, job opportunities or help, guidance with that?
If you look on our YouTube channel, there's actually student testimonials about what's happened to them following completion of their MSc. So they're worth a watch. A lot of our students want to go on to do PhDs. And some of them want to go into management and leadership, which is why we have such courses on that as well.
Okay, so there don't seem to have been many questions coming in for you.
Sorry, Michelle, I see in the answered questions, I think one of the questions was answered by critical care, but it was actually meant for health services management. Someone has asked when the on-campus hospital teaching will start for health service management students. We thought it was directed at critical care, but it's not.
Thank you. Natalia, do you want to answer that one?
Or about hospital teaching, we do not, in health services management, we do not have any clinical courses or teaching in the hospital. And the program itself starts on the 9th of November.
I mean, what we do have in health service management is we do have some, like in the introductory module, we do have some managers or of the health service that will give some presentations to you. So people who are currently practicing as well, which can be useful to see their point of view as well. So I hope that answers your question. But certainly in the run up to sort of Christmas, we expect that our formal teaching sessions will be via Zoom, but we hope to have some more informal discussions in person. But obviously we can't fully predict what the government rules will be. And certainly a few weeks ago it looked much better than what it is now. But we just have to wait and see what happens.
Okay, I think Kirsty wants to answer this next question live. Could our registration process for NMC codes would be quicker after graduation?
And for the Nursing and Midwifery Council, no, it won't actually make it any quicker. You'll still need to go through all the process. The Advanced Nursing Science isn't a practical course. There isn't any clinical involved in it, so it would just be the normal process you would go through for the NMC.
Okay. Oh, and there's a question that just completely disappeared that was for critical care.
Got it.
I don't know where it's went. It's gone.
Should that be answered in case people have the same question?
Yeah, possibly. A lot of questions that are coming in are very they're cross programs really when we're sort of asking things. We've only got a few minutes left just now anyway, so if anyone wants to get any questions into us, then definitely just do that quickly now before we start to tie things up. Health service management, again, will we learn about hospital planning in the MSc Health Service Management course?
Hi. I wouldn't say you would specifically learn about hospital planning. What you'll learn is concepts and theories that you can apply to your specific situation. So we will give you broad ideas about how to bring about a change process, or how systems work. So hospitals within a sort of healthcare system, and look at sort of systems thinking. In terms of hospital planning specifically, that wouldn't be like a core module, if you see what I mean. So we would just give you, the skills that you would apply to a specific situation. I hope that
Answers.
sort of answers your question.
Okay, we'll make this the last question for just now then. Again, health services management. Will we be able to discuss our modules on the induction meeting on the 5th of November?
Yeah. And so with the health service management, actually in the semester one, all your modules are core. So there isn't such a great rush to choose what optional modules you want to take. So certainly you don't need to choose that before you arrive. And Natalia and myself do prepare a little outline of each of the modules. A little paragraph about what they entail. So you'll have time to browse through that and ask questions and things like that. Is that correct, Natalia?
That's absolutely correct. And also I wanted to say that, of course, many of you have already been in touch by email, and if you would rather have a face-to-face session on Zoom or Skype or anything, you can just email me and we will arrange a session if you feel more comfortable talking face-to-face. That's no problem at all, and I'll send you all the materials you may want to see.
I mean, perhaps I just add that all students get offered like a one-to-one session with an academic advisor. So if I was your academic advisor, we will meet in the first within the first 3 weeks, let's say, as a one-on-one appointment, probably via Zoom, but we can discuss, what your career plans are or what you're expecting to get out of the programme. And that can perhaps help guide you as well in your choice of modules.
Okay, we've got 2 minutes left. Are there any more questions to come in? I know I said the last question at the last question, but just in case there's something that's preying on someone's mind. Anything for Kirsty? Anything for Emma, Julie, Sue or Campbell? Any questions more? Anything more coming in? Okay, maybe not. What I've done for you is in the Zoom webinar chat box, I've put a whole list of important links there for you, from everything from the FAQs page, which is really important, your session dates, CAS, confirmation of acceptance for studies, starting your programme, travelling to Glasgow, health and safety on campus, for how we're actually functioning on campus as well, registration, enrolment, library access, everything's there for you as well if you want to just take a look at those links. Again, this session is being recorded, so you will have access to it to be able to go and rewatch and re-get those links as well, just in case you miss anything today, or maybe the Scottish accents have been misunderstood in any way. At least you've got everything there. One quick question then. Is there we'll have a highlight for the subjects for this programme, MSc Advanced Nursing Sciences? Do you have a list of the subjects for that? Well, they should be all on the web page anyway, shouldn't they?
Yes, I've sent a list of the subjects out, but I'll send them again to Zainab.
Right. Okie doke, that's fine. So they've already got a copy of that then, yeah?
Yeah, but I'll send it again.
Okay. Let's see. Okay, I think that's us for the morning. Thank you so much, Natalia, Sue, Julie, Emma and Kirsty. I know you're all super busy and I need to get back to your regular jobs. I hope all the information that we've given you has been of help to you. Please, like I said, there is no silly question. Please get in contact with us if there's a problem, something preying on your mind. Just email us, it's not a problem. We'll be able to get back to you. If we don't know the answer, we'll find the answer and we'll get back to you with regards to that as well, okay? So take care, everyone, and it was lovely to see everyone, and enjoy the rest of your morning and the rest of your day. Thanks, bye.
Bye.